السلام عليكم ورحمة الله جميعا طلاب المرحلة الرابعة كلية الطب جامعة ميسان. معكم دكتور حيدر سعدون قاسم, and we will start today our series of lectures about infectious diseases. The first topics will be about enteric fever, or what we call typhoid fever. And this is first picture for housemaid Mary Malone, which is a well-known transmitter of the infection from house to house. تقريبا اشتغلت في 7 مكانات متعددة, وكل مكان تشتغل به أو كل بيت تعمل به يتم نقل المرض اللي هو كانت هي كارير للسالمونيلا تايفي عن طريق الخروج, وإلى أن اكتشفوا أنه هي سبب الفيفر في كل مكان تعمل فيه, يعني يصابون أهل البيت بالفيفر. وهاي القصة هي 1931, هي from Ireland, and this is the doctors with her in quarantine. تم حجزها هذه الhousemaid. Typhoid, it is a Greek word. It means dull expression of the face. يعني ذلك احنا نشوف المريض ابو التايفويد فيبر يكون facial expression مالته وكأنه يعني شلون نحو stupidity أو not responding. The term typhoid was given by Lewis in 1829 to distinguish it from the typhus fever. أكو حمى التايفوس هاي غيرها. Enteric fever, وما يسمى الحمى المعوية, is invasive bacterial infection acquired through consumption of contaminated food or water. So the source of infection, contaminated food or water. The organism classically responsible for enteric fever are Salmonella typhi, serotype typhi, and paratyphi A, B, C, Salmonella enterica. It is an acute generalized infection of the reticuloendothelial, intestinal, lymphoid tissue, and the gallbladder. This is the site for predilection of the infection. Epidemiology, according to WHO, about 16 million cases occur annually, resulting in more than 600,000 deaths annually, more than 62 in Asia, of which 7 million occur annually in Southeast Asia. أكثر مكان به هو حقيقة الهند. Other countries with high incidence include Central, South America, Africa, and New Guinea and Papua. The incidence of the disease in UK is reported to be just 1 case per 100,000 population. So it is rare in UK. 1994, for example, 26,000 of cases, about 500 cases per billion were reported from America, with mortality about 1,030,000 deaths. The mean incidence in developing countries is estimated to be about 150 cases per million population per year. In Latin America, to 1,000 cases per million in some Asian countries. As I said, India at the top of the list. Case fatality about 2.5. In 1885, veterinary scientist called Daniel Salmon discovered the first strain of Salmonella. For the honor of its discovery, they called it salmonellosis. Discovered it in the intestine of pig. So about the microorganisms, Salmonella gram-negative rods, facultative aerobic motile, 1.3 micrometer, 0.5 micrometer in size. Currently have more than 2,000 serotype, 2 group, enteric fever group, food poisoning group. The bacilli are killed at 55 and 60 centigrade for 15 minutes. They are killed within 5 minutes by mercury chloride or 5% phenol. Boiling or chlorination of water is enough to kill the bacilli, and even pasteurization of the milk. The proportion of typhoid to paratyphoid is 10:1. Paratyphoid B is rare and paratyphoid C is very rare in India. So the commonest is typhoid. Age group, in endemic setting, enteric fever is more common in children and young age group. Human are the only reservoir for Salmonella enterica serotype typhi. In recent study, the disease affects even child at age of 1 to 5 years. Environmental factors So the cases are observed throughout the year. The peak incidence of typhoid fever is reported during July to September. This period coincides with raining season and substantial increase in fly population. So fly have a role in transmission of the disease. Social factors, the disease of poor socioeconomic status, pollution of drinking water, open air defecation and urination, low standard of food and low hygiene. The incubation period is usually as short as 3 days, as long as 21 days, and it's between 10 to 14 days. Reservoir, man is the only reservoir. Period of communicability, a case is infectious as long as the bacilli appear in the stool or urine. So we have a carrier state. Mode of transmission is mainly fecal-oral route, either direct through hand or with feces or urine, or contamination, or indirectly by ingestion of contaminated water or milk food through flies. Contaminated ice, cream, and milk product are its source of infection. Carrier may be temporary or chronic. Temporary, convalescent, or incubatory. Carrier usually excrete bacilli for up to 8 weeks. And person who excrete bacilli for more than 1 year after a clinical attack are called chronic carrier. So convalescent or incubatory carrier 8 weeks, chronic more than 1 year. This is the diagram show the bacilli affect mainly reticuloendothelial system. This is macrophage, first exposure by Peyer's patches, lymph node in the small intestine, Peyer's patches enlargement, engulfed by macrophage, the microorganism, and it can be transmitted to the reticuloendothelial system like liver and spleen. So disease affect mainly small intestinal Peyer's patches. Salmonella typhi pathogenesis, infection, the body via Peyer's patches, the bacteria migrate through mesenteric lymph nodes to the spleen and liver after multiplication. On this side, the bacteria can migrate back to the Peyer's patches, small intestine, secondary exposure, and consequence, the clinical syndrome are seen there. This is clinical feature. This picture of patient with skin rash, this is what we call rose spot rash. Rose spot rash, and the significance of this rose spot rash usually occurs in the second week. It can be cultured and the microorganism is there. Clinical feature, first week, fever, step ladder, مثل واحد دا يصعد درج. Usually intermittent fever, 40 to 41 over 4 to 5 days, accompanied by headache, vague abdominal pain, usually constipation, maybe diarrhea in pediatric age group. Second week, between 7 and 10 days, hepatosplenomegaly, about 70% of patients having hepatosplenomegaly, relative bradycardia. It's very important, relative bradycardia. What do we mean by relative bradycardia? هنقول المريض حرارته 40 والنبض مالته 70 أو 80 مع العلم ما عنده مشكلة بالكوندكشن بالكاردياك rate. According to the Fabry's law, for each increase in 1 centigrade above normal, there will be an increase to 15 to 20 beats per minute. So the patient high-grade fever do not accompany by tachycardia. This is called relative bradycardia. Third week is the week of complication or the week of typhoid status, dull expression of the face, apathy, toxemia, delirium, disoriented, diarrhea can occur. If left untreated, risk of 10%, there is be high risk of 5 to 10% intestinal hemorrhage and perforation at site of Peyer's patches. Rare complication of typhoid fever, typhoid hepatitis, empyema, osteomyelitis, and psychosis. About 2 to 5% of patients may become chronic carrier in their gallbladder. Paratyphoid, the course tends to be short and mild than the typhoid, and the onset is usually abrupt with acute enteritis. The rash may be more abundant, and the intestinal complication is less frequent. So paratyphoid is benign course. Diagnosis, this is a blood culture. Diagnosis is a blood culture. So typhoid should be considered any patient with unexplained fever in endemic area and those with history of recent travel to endemic area. what we mean by endemic area: when the infection maintains its prevalence in the community. Prolonged fever, rose spot, relative bradycardia, leukopenia, highly suggestive of typhoid fever. Widal test, which is serological test, this is not diagnostic for typhoid fever. It depends on antibody IgG, IgM against antigen of the microorganism, which is O, somatic or flagellar antigen, or V, virulent antigen. In the absence of recent immunization, high titer 1/640 is suggestive but not specific. PCR is usually diagnostic, about more than 90% of the cases. Blood culture, 70 to 80% of the cases positive in the first weeks. Stool uric culture, 75% the second, third week. Bone marrow, highest positivity of culture, positive about 95%, especially for those who are taking antibiotics. In many cases, the diagnosis of enteric fever is made presumptively in patients with protracted fever without alternative explanation. يعني أنا من أشخص مريض أو أشك بمريض عنده انتريك فيفر وهو بالانديميك اريا والبيشنت توكسيك، ممكن ابدي علاج مو انتظر البلاد كلتشر اللي يطلع ورا 5 ايام او 7 ايام. presumptive diagnosis. نانا differential diagnosis of typhoid fever ممكن نخلي بروسيلا infectious mono, other infections that cause lymphadenopathy, and never forget lymphoma. Management, we have supportive management and specific management. Antibiotics, drug of choice. Chloramphenicol nowadays out of use. لا زال يستخدم في الهند لأنه علاج رخيص. نعرف الكلورامفينيكول صفة ال WHO وحتى ال FDA not approved لأنه يسوي لنا aplastic anemia. Ampicillin amoxicillin, there is cases of resistance for ampicillin amoxicillin. طبعا high dose 1 gram by 4. Methibrin, yes, there is good percentage of patients responding to this antimicrobial treatment. Fluoroquinolone is the drug of choice, ciprofloxacin and levofloxacin. In case of quinolone-resistant azithromycin, third generation cephalosporin, also effective. The treatment of enteric fever has been complicated by development of resistance to penicillin, trimethoprim, and even chloramphenicol. Additionally, decreased susceptibility to fluoroquinolone resistant. حقيقة مشكلة resistant يعني عالمية. نسينا نقول أكثر بلد resistant هو باكستان، وباكستان سجلت هواي كيسات of chloroquine يعني ciprofloxacin resistant، وقاموا يستخدمون أو WHO أو recommended هو الميرونين. يعني بالباكستان ciprofloxacin resistant typhoid fever drug of choice هو ميروبينين، اللي هو broad spectrum antibiotics penicillin derivative. هذه حكيناها. For patients with suspected or known enteric fever and severe systemic illness, we suggest adjuvant dexamethasone dose 3 mg per kg, followed by 1 mg every 6 hours for total 48 hours. إذا patient يجينا toxic لا مانع أن نعطيه steroid بالدوز اللي مذكورة. Treatment of enteric fever should be for 2 weeks. Paroxysmal persist for 5 days after the start of specific therapy. يعني من نبدأ العلاج للمريض نقول له الحرارة مالتك راح تختفي أو تقل بعد اليوم الخامس وليس نفس اليوم. Relapse after clinical cure can occur or 2 to 3 weeks after resolution of illness and should be treated with additional course of antibiotics. عادة نعطيهم ciprofloxacin. Even with effective treatment, there is still danger of complication, recruitness of the disease, and development of carrier. Chronic carrier should be treated with ciprofloxacin, هنا high dose 750 ملغ 1/2 for 4 weeks لمدة شهر. And if there is a still carrier, so a stool culture for salmonella, you should go ahead for cholecystectomy. Control of typhoid fever measured directed to reservoir, case detection, isolation. طبعا لازم ندخله isolation بالحميات لأنه infectious disease. Detection treatment of carrier very important. أكثر شيء الكارير هم الفود handler، يعني لازم نسوي screening for all food handler. measures at routes of transmission، طبعا water sanitation, food sanitation, excreta disposal, flight control, measure for susceptibilities, immunoprophylaxis, health education. يعني هل يوجد لقاح؟ نعم. 3 types of vaccination: injectable typhoid, live oral, and tab vaccine. None of these offer complete protection, and periodic revaccination is needed if exposure risk continue. طبعا دائما يستخدمون هذا البروفلاكسيس فاكسين injection بالميليتري service, during military service. Thank you.